Do you know what a heart attack is? A heart attack, medically known as a myocardial infarction, is a serious condition that occurs when blood flow to a part of your heart gets blocked. It's like a traffic jam in your heart's blood vessels, where the oxygen-rich blood simply can't get through. This blockage can damage or destroy part of the heart muscle, and it's as serious as it sounds. Heart attacks are surprisingly common. They're one of the leading causes of death worldwide, affecting millions of people each year. But what makes this condition particularly insidious is that it can strike anyone at any time, regardless of age or lifestyle. The good news is, with a bit of knowledge and awareness, we can all take steps to prevent heart attacks. Understanding this condition, its causes, and its symptoms is the first step towards prevention. So, let's dive deeper into what a heart attack is and how we can protect ourselves and our loved ones. There are different types of heart attacks, each with distinct causes and consequences. The first type we'll discuss is known as a STEMI, or ST elevation myocardial infarction. This is the most severe type of heart attack, caused by a total blockage of a coronary artery, which supplies blood to the heart. When this happens, the heart muscle begins to die from the lack of oxygenated blood. Next up is the NSTEMI, or non-ST elevation myocardial infarction. This type of heart attack occurs when a coronary artery is partially blocked, reducing the blood supply to the heart. Lastly, we have coronary spasms, also known as unstable angina. This type of heart attack is caused by a temporary tightening or constriction of the coronary arteries, which can reduce or even stop blood flow to the heart momentarily. Each type requires a different approach, but recognizing the signs is the first step. The signs of a heart attack can vary, but there are some common symptoms to be aware of. The most well-known sign is chest pain, often described as a pressure, squeezing, or aching sensation in the center of the chest. This may radiate to the arms, jaw, neck, or back. But it's not just about chest pain. Shortness of breath, often accompanied by a feeling of overwhelming fatigue, can be a vital clue. This can occur with or without chest discomfort. Another symptom that people often overlook is a sudden onset of nausea or vomiting. This can be accompanied by a cold sweat and a sense of impending doom. Finally, feeling lightheaded or dizzy can also be a warning sign. This is especially true if it's accompanied by any of the other symptoms we've discussed. If you or someone around you experiences any of these signs, it's crucial to seek immediate medical attention. Remember, time is muscle. The sooner the treatment, the better the outcome. Certain factors can increase your risk of suffering a heart attack. You see, age is a significant risk factor. As we grow older, our heart's health naturally declines, making us more susceptible. Gender also plays a role, with men generally at higher risk than women. Family history is another important factor to consider. If your parents or siblings have had heart attacks, your risk could be higher. Lifestyle choices, such as smoking, can significantly increase your risk. Then there are medical conditions that may up the ante. High blood pressure, high cholesterol, and diabetes can damage your heart over time, making a heart attack more likely. Obesity is a major risk factor as well, often leading to high blood pressure, high cholesterol, and diabetes. And let's not forget about stress. Chronic, unmanaged stress can contribute to heart problems too. Knowing these risk factors can help you take steps to lower your risk. That's the power of knowledge. It gives you the ability to take charge of your heart health. Diagnosing a heart attack involves various tests and treatments. When a heart attack is suspected, often the first test is an electrocardiogram, or EKG, which monitors your heart's electrical activity. Abnormal EKG results can indicate a heart attack. Blood tests are also conducted to check for elevated levels of certain proteins in the blood. When heart cells die, they release these proteins, which can be detected in a blood test. Imaging tests like echocardiograms or echo can provide a detailed picture of the heart, helping doctors identify areas of poor blood flow. When it comes to treatment, medications are often used to break up blood clots and restore blood flow. In some cases, medical procedures are necessary. Stents, small wire mesh tubes, can be used to keep arteries open, while bypass surgery involves grafting blood vessels from elsewhere in the body to reroute blood around a blocked artery. These tests and treatments are crucial in saving lives and preventing further heart damage. A heart attack can lead to serious complications and even death. Now, let's delve into some of these complications. One of the most severe complications is heart failure, where the heart is unable to pump blood efficiently, leading to symptoms like shortness of breath and fatigue. Another potential complication is arrhythmias or abnormal heart rhythms, which can disrupt the normal functioning of the heart, leading to dizziness or even cardiac arrest. But don't be alarmed. Fortunately, these complications can be prevented with some lifestyle adjustments and medications. Regular physical activity, a balanced diet, and avoiding tobacco and excessive alcohol can work wonders for your heart's health. Medications such as aspirin or beta blockers can also be prescribed by your doctor to reduce the risk of heart attacks. Remember, these preventive measures are not just for those who have already experienced a heart attack, but for everyone who wants to maintain a healthy heart. Prevention is always better than cure, so take care of your heart. So, that was a brief overview of heart attacks. We've traveled through the heart's chambers, dissected the types of attacks it can endure, and understood the signs and symptoms that can signal its distress. We've also examined the risk factors that make some of us more susceptible, and the crucial lab tests and treatments that can turn the tide against this silent killer. We've seen the complications that can arise if a heart attack goes unaddressed, and equally, the ways we can fortify ourselves against it. It's clear that awareness and early intervention are our most potent weapons. Just as with any journey, the key is to be prepared. Equip yourself with knowledge, stay vigilant for the signs, and remember to act quickly. Your heart doesn't beat just for you, it beats for all those who love and care for you. Remember, your heart is in your hands. Take care of it and it will take care of you.